NCLEX RN Practice Questions and Answers 2026. Question 1. A client is admitted to the hospital with a diagnosis of aplastic anemia and placed on isolation. The nurse notices a family member entering the room without applying the appropriate apparel. The nurse will approach the family member using the following information as a basis for discussion. Here are the options. Option A. The risks of exposure of the visitor to infectious organisms is great. Option B. Hospital regulations mandate that everyone in the facility adhere to appropriate codes. Option C. The client is at extreme risk of acquiring infections. Option D. Adherence to the guidelines are the latest Centers for Disease Control and Prevention recommendations on use of protective apparel. The correct answer is option C. The client is at extreme risk of acquiring infections. Although clients with a compromised immune system may acquire infections, the primary emphasis is on protecting the client. B. Most people are aware of the guidelines once they see posted signs, so quoting regulations is not likely to result in consistent adherence to regulations. C. Clients with aplastic anemia have white cell counts of 2,000 or lower, making them more vulnerable to infections from others. Question 2. The nurse enters the room of a client on which a do not resuscitate order has been written and discovers that she is not breathing. Once the husband realizes what has occurred, he yells, "Please save her." The nurse's action would be, here are the options. Option A. Call the physician and inform him that the client has expired. Option B. Remind the husband that the physician wrote an order not to resuscitate. Option C. Discuss with the husband that these orders are written only on clients who are not likely to recover with resuscitative efforts. Option D. Call a code and proceed with cardiopulmonary resuscitation. The correct answer is option D. Call a code and proceed with cardiopulmonary resuscitation. A, B, C. The last request from the husband overrides the decision not to initiate resuscitation efforts. D. The nurse should begin cardiopulmonary resuscitation unless a leading will and durable power of attorney are in force. In the meantime, the nurse should talk with the husband and notify the doctor. Question 3. The nurse is in the hallway and one of the visitors faints. The nurse should. Here are the options. Option A. Sit the victim up and lightly slap his face. Option B. Elevate the victim's legs. Option C. Apply a cool cloth to the victim's neck and forehead until he recovers. Option D. Sit the victim up and place the head between the knees. The correct answer is option B. Elevate the victim's legs. A sitting the client up defeats the goal of re-establishing cerebral blood flow. B. Elevating the legs anatomically redirects blood flow to the cerebral area. C. This strategy is a nice general comfort measure after the victim has regained consciousness. D. The strategy is not as effective a strategy in helping the client to regain consciousness as elevating the legs. Question 4. The nurse is teaching a client how to perform monthly testicular self-examination (TSC) and states that it is best to perform the procedure right after showering. This statement is made by the nurse based on the knowledge that, here are the options. Option A. The client is more likely to remember to perform the TSC when in the nude. Option B. When the scrotum is exposed to cool temperatures, the testicles become large and bulky. Option C. The scrotum will be softer and more relaxed after a warm shower, making the testicles easier to palpate. Option D. The examination will be less painful at this time. The correct answer is option C. The scrotum will be softer and more relaxed after a warm shower, making the testicles easier to palpate. A nudity is not a trigger for reminding males to perform TSC. The testicles become more firm when exposed to cool temperatures, but not large and bulky. See, the testicles will be lower and more easily palpated with warmer temperatures. A protective mechanism of the body to protect sperm production is for the scrotum to pull closer to the body when exposed to cooler temperatures. D. The examination should not be painful. Question 5. The nurse discovers that a 78-year-old client who received hydralazine aprealine 20 mg 45 minutes ago has a blood pressure of 70/40 mmHg. The client has been on this dose of the medication for 3 years. Which of the following data is most likely significant in relation to the cause of the low blood pressure? Here are the options. Option A. Pedal pulses 11-week. Option B. 24-hour intake 1000 ml/day for past 2 days. Option C. Serum potassium 3.3. Option D. Pulse rate 150 bpm. The correct answer is option B. 24-hour intake 1000 ml/day for past 2 days. A. Decreased pulse volume and increased pulse rate are signs of an acute hypotensive episode. B. Inadequate fluid volume when taking vasodilators can result in a drop in blood pressure when vasodilation starts to physiologically occur as an action of the drug. C. A potassium level of 3.3 would not be associated with a significant drop in blood pressure. Question 6. A client admitted with a diagnosis of possible myocardial infarction is admitted to the unit from the emergency room. The nurse's first action when admitting the client will be to. Here are the options. Option A. Obtain vital signs. Option B. Connect the client to the cardiac monitor. Option C. Ask the client if he is still having chest pain. Option D. Complete the history profile. The correct answer is option B. Connect the client to the cardiac monitor. A. Obtaining vital signs is important after connecting the client to the monitor because vital signs should be stable before the client is discharged from the emergency room. They all are important, but the first priority is to monitor the client's rhythm. See if the client is in severe pain. Pain medication should be given after connecting him to the monitor and obtaining vital signs. D. Completion of the history profile is the least important of the nursing actions. Question 7. The nurse is interviewing a client with a diagnosis of possible abdominal aortic aneurysm. Which of the following statements will be reflected in the client's chief complaint? Here are the options. Option A. I've been having a dull pain at the upper left shoulder. Option B. My legs have been numb for 3 months. Option C. I've only been urinating 3 times a day lately. Option D. I don't remember anything in particular. I just haven't felt well. The correct answer is option D. I don't remember anything in particular. I just haven't felt well. A, B, C. These complaints are not specific signs and symptoms associated with abdominal aortic aneurysm. If symptoms are present, the aneurysm is expanding or rupture is imminent. D. Many clients may experience no symptoms. The only symptom may be a pulsation noted in the abdomen in the reclining position. Question 8. The nurse is collecting a nutritional history on a 28-year-old female client with iron deficiency anemia and learns that the client likes to eat white chalk. When implementing a teaching plan, the nurse should explain that this practice, here are the options. Option A. Will bind calcium and therefore interfere with its metabolism. Option B. will cause more premenstrual cramping. Option C interferes with iron absorption because the iron precipitates as an insoluble substance. Option D causes competition at iron receptor sites between iron and vitamin B1. The correct answer is option C. Interferes with iron absorption because the iron precipitates as an insoluble substance. Eating chalk is not related to calcium and its absorption. Poor nutritional habits may result in increased discomfort during premenstrual days, but this is not a primary reason for the client to stop eating chalk. Premenstrual discomfort has not been mentioned. C. Iron is rendered insoluble and is excreted through the gastrointestinal tract. D. There is no competition between the two nutrients. Question 9. Which of the following lab data is representative of a client with aplastic anemia? Here are the options. Option A. Hemoglobin 9.2, hematocrit 27, red blood cells 3.2 million. Option B. White blood cells 4,000, erythrocytes 2.5 million, thrombocytes 100,000. Option C. White blood cells 3,000, hematocrit 27, red blood cells 2.8 million. Option D. Red blood cells 1 million, white blood cells 1,500, thrombocytes 16,000. The correct answer is option D. Red blood cells 1 million, white blood cells 1,500, thrombocytes 16,000. A, B, C. Although all of the lab data are abnormal and although these values are decreased in aplastic anemia, the disorder is defined by severe deficits in red cell, white cell, and platelet counts. D. Aplastic anemia is typically defined in terms of abnormalities of red blood cell count, usually 1 million, white cell count 2,000, and thrombocytes 20,000. Question 10. A 20-year-old male client is being treated for protein deficiency. If he likes all of the following foods, which one would the nurse recommend to increase in the diet? Here are the options. Option A. Cantaloupe. Option B. Rice. Option C. Chicken. Option D. Green beans. The correct answer is option C. Chicken. A cantaloupe is a good source of carbohydrates, vitamin C, and vitamin A. B. Rice contains about 4 g of protein per 200 g. C. Chicken contains 35 g protein per breast. Chicken is a rich source of vitamin B6 pyridoxine, which is needed for adequate protein synthesis. As protein intake increases, vitamin B6 intake must also be increased. Vitamin B6 is a coenzyme in amino acid metabolism. D. Green beans only contain 2 g of protein per cup. Question 11. A client states to his nurse that I was told by the doctor not to take one of my drugs because it seems to have caused decreasing blood cells. Based on this information, which drug might the nurse expect to be discontinued? Here are the options. Option A. Prednisone. Option B. Timolol malate blockadrin. Option C. Garamycin gentamicin. Option D. Phenytoin dilantin. The correct answer is option D. Phenytoin dilantin. A prednisone is not linked with hematological side effects. The timolol, a adrenergic blocker, is metabolized by the liver. It has not been linked to blood dyscrasia. C. Gentamicin is ototoxic and nephrotoxic. D. Phenytoin usage has been linked to blood dyscrasias such as aplastic anemia. The drug most commonly linked to aplastic anemia is chloramphenicol-chloramystin. Question 12. 48 hours after a thyroidectomy, A female client complains of numbness and tingling of the toes and fingers. The nurse notes upper arm and facial twitching. The nurse needs to. Here are the options. Option A. Report the findings to the physician. Option B. Assist the client to do range of motion exercises. Option C. Check the client's potassium level. Option D. Administer the as-needed dose of phenytoin dilantin. The correct answer is option A. Report the findings to the physician. A muscular hyperactivity and paresthesias may indicate hypocalcemic tetany and require immediate administration of calcium gluconate. Tetany can occur if the parathyroid glands were erroneously excised during surgery. The range of motion exercises are not appropriate top-presenting symptoms. See, these characteristics are not usual signs of potassium imbalance, but of calcium imbalance. D-phenytoin is indicated for seizure activity mainly of neurological origin. Question 13. The nurse is admitting a client with folic acid deficiency anemia. Which of the following questions is most important for the nurse to ask the client? Here are the options. Option A. Do you take aspirin on a regular basis? Option B. Do you drink alcohol on a regular basis? Option C. Do you eat red meat? Option D. Have your stools been normal? The correct answer is option B. Do you drink alcohol on a regular basis? A. Aspirin does not affect folic acid absorption. B. Folic acid deficiency is strongly associated with alcohol abuse. C. Because folic acid is a coenzyme for single carbon transfer, purines, calves' liver, or other purines are the meat sources. D. Folic acid does not affect stool character. Question 14. An 18-month-old child has been playing in the garage. His mother brings him to a nurse's home complaining of his mouth being sore. His lips and mouth are soapy and white, with small ulcerated areas beginning to form. The child begins to vomit. His pulse is rapid and weak. The nurse suspects that the child has. Here are the options. Option A. Inhaled gasoline fumes. Option B. Ingested a caustic alkali. Option C. Eaten construction chalk. Option D. Lead poisoning. The correct answer is option B. Ingested a caustic alkali. A, C, D. These agents would not cause ulcerations on mouth and lips. These strong alkali or acids will cause burns and ulcerations in the mucous membranes. Question 15. In discussing the plan of care for a child with chronic nephrosis with the mother, the nurse identifies that the purpose of weighing the child is to. Here are the options. Option A. Measure adequacy of nutritional management. Option B. Check the accuracy of the fluid intake record. Option C. Impress the child with the importance of eating well. Option D. Determine changes in the amount of edema. The correct answer is option D. Determine changes in the amount of edema. Weighing a child with nephrosis is to assess for edema, not nutrition. B. See, this is not the purpose for weighing the child. D. Weight and measurement are the primary ways of evaluating edema and fluid shifts. Question 16. The parents of a 9-year-old child with acute lymphocytic leukemia expressed concern about his alopecia from cranial irradiation. The nurse explains that. Here are the options. Option A. Alopecia is an unavoidable side effect. Option B. There are several wig makers for children. Option C. Most children select a favorite hat to protect their heads. Option D. His hair will grow back in a few months. The correct answer is option D. His hair will grow back in a few months. Alopecia has occurred, and knowing it is a side effect does not address their concern. B. Although true, it does not give them hope for the future. C. Although true, it does not provide them with information of the temporary nature of the situation. D. Knowing the hair will grow back provides comfort that the alopecia is temporary. Question 17. Loss of appetite for a child with leukemia is a major recurrent problem. The plan of care should be designed to. Here are the options. Option A. Reinforce attempts to eat. Option B. Help the child gain weight. Option C. Increase his appetite. Option D. Make mealtimes pleasant. The correct answer is option A. Reinforce attempts to eat. Ignoring refusals to eat and rewarding eating attempts are the most successful means of increasing intake. B. This goal is not specific enough or related to the loss of appetite. C. This goal is not possible at this time based on his illness. D. This goal is helpful, but alone will not address his loss of appetite. Question 18. The mother of a child taking phenytoin will need to plan appropriate mouth care and gingival stimulation. When toothbrushing is contraindicated, the next most effective cleansing and gingival stimulation technique would be. Here are the options. Option A. Using a water pick. Option B. Rinsing with water. Option C. Rinsing with hydrogen peroxide. Option B. Rinsing with baking soda. The correct answer is option A. Using a water pick. This technique provides effective rinsing and gingival stimulation. B. This technique does not provide gingival stimulation. C. This technique provides effective rinsing but not gingival stimulation. Using peroxide is not pleasant for the child. D. This technique provides effective rinsing but not gingival stimulation. Question 19. When planning care for a 9-year-old client, the nurse uses which of the most effective means of helping siblings cope with their feelings about a brother who is terminally ill? Here are the options. Option A. Open discussion and understanding. Option B. Play acting out feelings in different roles. Option C. Storytelling. Option D. Drawing pictures. The correct answer is option B. Play acting out feelings in different roles. When dealing with grief, siblings are usually most comfortable initially with open discussion. B. Assuming different roles allows children to act out their feelings without fear of reprisals and to gain insight and control. C. This method may be helpful, but having the child take an active part through role-playing is more effective. D. This technique may be helpful, but being an active participant through role-playing is more effective. Question 20. During the active phase of rheumatic fever, the nurse teaches parents of a child with acute rheumatic fever to assist in minimizing joint pain and promoting healing by. Here are the options. Option A. Putting all joints through full range of motion twice daily. Option B. Massaging the joints briskly with lotion or liniment after bath. Option C. Immobilizing the joints in functional position using splints, rolls, and pillows. Option D. Applying warm water bottle or heating pads over involved joints. The correct answer is option C. Immobilizing the joints in functional position using splints, rolls, and pillows. A. Any movement of the joint causes severe pain. B. Touching or moving the joint causes severe pain. C. Immobilization in a functional position allows the joint to rest and heal. D. Pressure from the warm water bottle or pads can cause severe pain or burning of the skin. Question 21. The initial focus when providing nursing care for a child with rheumatic fever during the acute phase of the illness should be to. Here are the options. Option A. Maintain contact with her parents. Option B. Provide for physical and psychological rest. Option C. Provide a nutritious diet. Option D. Maintain her interest in school. The correct answer is option B. Provide for physical and psychological rest. This goal is helpful, but rest is essential during the acute phase. B. Rest is essential for healing to occur and for pain to be relieved. C. This goal is important, but rest is essential. D. This goal should be part of the plan of care, but it is not the priority during the acute phase. Question 22. During discharge planning, parents of a child with rheumatic fever should be able to identify which of the following as toxic symptoms of sodium salicylate. Here are the options. Option A. Tinnitus and nausea. Option B. Dermatitis and blurred vision. Option C. Unconsciousness and acetone odor of the breath. Option D. Chills and an elevation of temperature. The correct answer is option A. Tinnitus and nausea. These are toxic symptoms of sodium salicylate. B, C, D. These are not symptoms associated with sodium salicylate. Question 23. Parents of a child with rheumatic fever express concern that she will always be arthritic. The nurse discusses their concerns and tells them the joint pain usually. Here are the options. Option A. Subsides in 3 weeks. Option B. Is relieved by aspirin. Option C. Is responsive to ibuprofen Motrin. Option D. Subsides in 36 days. The correct answer is option A. Subsides in 3 weeks. Joints usually remain inflamed and tender until the disease runs its course in 3 weeks. B. This response does not answer the question of whether she will always be arthritic. C. This response does not answer the question asked. D. The disease takes 3 weeks to run its course. Question 24. In caring at home for a child who just ingested a caustic alkali, the nurse would immediately tell the mother to. Here are the options. Option A. Give vinegar, lemon juice, or orange juice. Option B. Phone the doctor. Option C. Take the child to the emergency room. Option D. Induce vomiting. The correct answer is option A. Give vinegar, lemon juice, or orange juice. The immediate action is to neutralize the action of the chemical before further damage takes place. B. This action should be done after neutralizing the chemical. C. This action should be done after neutralizing the chemical. D. Never induce vomiting with a strong alkali or acid. Additional damage will be done when the child vomits the chemical. Question 25. The most important goal in the care plan for a child who was hospitalized with an accidental overdose would be to. Here are the options. Option A. Determine child's activity pattern. Option B. Reduce mother's sense of guilt. Option C. Instruct parents in use of NCLEX. Option D. Teach parents appropriate safety precautions. The correct answer is option D. Teach parents appropriate safety precautions. This goal is not the most important. B. There's always some guilt when an accident occurs. However, the priority is to be sure future accidents are prevented. C. NCLEX is not used for caustic alkali and acid ingestions. D. Determining the parent's knowledge about safety hazards and teaching appropriate preventive measures are likely to prevent recurrence of accidents. Question 26. A 4-year-old has an imaginary playmate, which concerns the mother. The nurse's best response would be, here are the options. Option A. I understand your concern and will assist you with a referral. Option B. Try not to worry because you will just upset your child. Option C. Just ignore the behavior and it should disappear by age 8. Option D. This is appropriate behavior for a preschooler and should not be a concern. The correct answer is option D. This is appropriate behavior for a preschooler and should not be a concern. A this is normal for a preschooler and a referral is not appropriate. B telling a parent not to worry is unhelpful. This response does not address the mother's concern. C this response is incorrect. The behavior is normal and will usually disappear by the time the child enters school. D this behavior is normal development for a preschooler. Question 27. Parents should be taught not to prop the bottle when feeding their infants. In addition to the risk of choking, it puts the infant at risk for, here are the options. Option A. Otitis media. Option B. Option C. Conjunctivitis. Option D. Tonsillitis. The correct answer is option A. Otitis media. Because the eustachian tube is short and straight in the infant, formula that pools in the back of the throat attacks bacteria which can enter the middle ear and cause an infection. B. Asthma is not associated with propping the bottle. C. Conjunctivitis is an eye infection and not associated with propping the bottle. D. Tonsillitis is usually a result of pharyngitis and not propping the bottle. Question 28. When assessing a female child for Turner's syndrome, the nurse observes for which of the following symptoms? Here are the options. Option A. Tall stature. Option B. Amenorrhea. Option C. Secondary sex characteristics. Option D. Gynecomastia. The correct answer is option B. Amenorrhea. This syndrome is caused by absence of one of the X chromosomes. These children are short in stature. B. Amenorrhea is a symptom of Turner's syndrome, which appears at puberty. C. Sexual infantilism is characteristic of this syndrome. D. Gynecomastia is a symptom in Klinefelter's syndrome. Question 29. The mother of a client is apprehensive about taking home her 2-year-old who was diagnosed with asthma after being admitted to the emergency room with difficulty breathing and cyanosis. She asked the nurse what symptoms she should look for so that this problem will not happen again. The nurse instructs her to watch for the following early symptoms. Here are the options. Option A. Fever, runny nose, and hyperactivity. Option B. Changes in breathing pattern, moodiness, fatigue, and edema of eyes. Option C. Fatigue, dark circles under the eyes, changes in breathing pattern, glassy eyes, and moodiness. Option D. Fever, cough, paleness, and wheezing. The correct answer is option C. Fatigue, dark circles under the eyes, changes in breathing pattern, glassy eyes, and moodiness. The child with asthma may not have fever unless there is an underlying infection. The edema of the eyes will not be present because the child with asthma is more likely to have dehydration related to excessive water loss during the work of breathing. See, all of these symptoms indicate decreased oxygenation and are early symptoms of asthma. D. Coughing and wheezing are not early signs of difficulty. Question 30. A 3-year-old female client is brought into the pediatric clinic because she limps. She has not been to the clinic since she was 9 months old. The nurse practitioner describes the limp as a Trendelenburg gait. this gait is characteristic of. Here are the options. Option A, scoliosis. Option B, dislocated hip. Option C, fractured femur. Option D, fractured pelvis. The correct answer is option B, dislocated hip. A. C. The Trendelenburg gait is not characteristic of any of these disorders. B. The downward slant of one hip is a positive sign of dislocation in the weight-bearing hip. If one hip is dislocated, the child walks with a characteristic limp known as the Trendelenburg gait. Question 31. A child has a nursing diagnosis of fluid volume excess related to compromised regulatory mechanisms. Which of the following nursing interventions is the most accurate measure to include in his care? Here are the options. Option A, weigh the child twice daily on the same scale. Option B, monitor intake and output. Option C, check urine-specific gravity of each voiding. Option D, observe for edema. The correct answer is option A. Weigh the child twice daily on the same scale. Although all of these interventions are important aspects of care, weight is the most sensitive indicator of fluid balance. B. Although monitoring intake and output is important, weight is a more accurate indicator of fluid status. C. Urine-specific gravity does not necessarily indicate a fluid volume excess. D. Edema may not be apparent, yet the client may have fluid volume excess. Question 32. The pediatric nurse charts that the parents of a 4-year-old child are very anxious. Which observation would indicate to the nurse unhealthy coping by these parents? Here are the options. Option A, discussing their needs with the nursing staff. Option B, discussing their needs with other family members. Option C, seeking support from their minister. Option D, refusing to participate in the child's care. The correct answer is option D, refusing to participate in the child's care. A, B, C. These methods are healthy ways of dealing with anxiety. D. Participation minimizes feelings of helplessness and powerlessness. It is important that parents have accurate information and that they seek support from sources available to them. Question 33. A 9-week-old female infant had a diagnosis of bilateral cleft lip and cleft palate. She has been admitted to the pediatric unit after surgical repair of the cleft lip. Which of the following nursing interventions would be appropriate during the first 24 hours? Here are the options. Option A, position on side or abdomen. Option B, maintain elbow restraints in place unless she is being directly supervised. Option C, clean suture line every shift. Option D, offer pacifier when she cries. The correct answer is option B, maintain elbow restraints in place unless she is being directly supervised. A. Placing the infant on her abdomen may allow for injury to the suture line. The elbow restraints prevent the infant from touching the suture line and yet leaves hands free. C. The suture line is cleaned as often as every hour to prevent crusting and scarring. D. Sucking of a bottle or pacifier places pressure on the suture line and may delay healing and cause scarring. Question 34. A 6-month-old infant who was diagnosed at 4 weeks of age with a ventricular septal defect was admitted today with a diagnosis of failure to thrive. His mother stated that he had not been eating well for the past month. A cardiac catheterization reveals congestive heart failure. All of the following nursing diagnoses are appropriate. Which nursing diagnosis should have priority? Here are the options. Option A, altered nutrition, less than body requirements related to inability to take in adequate calories. Option B. Altered growth and development related to decreased intake of food. Option C. Activity intolerance related to imbalance between oxygen supply and demand. Option D. Decreased cardiac output related to ineffective pumping action of the heart. The correct answer is option D. Decreased cardiac output related to ineffective pumping action of the heart. A. Altered nutrition occurs owing to the fatigue from decreased cardiac output associated with congestive heart failure. B. The decreased intake occurs due to fatigue from the altered cardiac output. C. Fatigue occurs due to the decreased cardiac output. D. The ineffective action of the myocardium leads to inadequate O2 to the tissues, which produces activity intolerance, altered nutrition, and altered growth and development. Question 35. A 9-year-old child was in the garage with his father, who was repairing a lawnmower. Some gasoline ignited and caused an explosion. His father was killed, and the child has split thickness and full thickness burns over 40% of his upper body, face, neck, and arms. All of the following nursing diagnoses are included on his care plan. Which of these nursing diagnoses should have top priority during the first 2,448 hours post-burn? Here are the options. Option A. Pain related to tissue damage from burns. Option B. Potential for infection related to contamination of wounds. Option C. Fluid volume deficit related to increased capillary permeability. Option D. Potential for impaired gas exchange related to edema of respiratory tract. The correct answer is option D. Potential for impaired gas exchange related to edema of respiratory tract. A, B, C. These answers are all correct. However, maintenance of airway is the top priority. D. Persons burned about the face and neck during an explosion are also likely to suffer burns of the respiratory tract, which can lead to edema and respiratory arrest. Question 36. A female baby was born with Talipes equinovarus. Her mother has requested that the nurse assigned to the baby come to her room to discuss the baby's condition. The nurse knows that the pediatrician has discussed the baby's condition with her mother and that an orthopedist has been consulted but has not yet seen the baby. What should the nurse do first? Here are the options. Option A. Call the orthopedist and request that he come to see the baby now. Option B. Question the mother and find out what the pediatrician has told her about the baby's condition. Option C. Tell the mother that this is not a serious condition. Option D. Tell the mother that this condition has been successfully treated with exercises, casts, and / braces. The correct answer is option B. Question the mother and find out what the pediatrician has told her about the baby's condition. A. The nurse should call the orthopedist after assessing the mother's knowledge. B. The nurse must first assess the knowledge of the parent before attempting any explanation. C. The nurse should assess the mother's knowledge of the baby's condition as the first priority. D. The statement is generally accurate, but the priority is to assess the mother's current understanding first, as stated in option B. Question 37. Cystic fibrosis is transmitted as an autosomal recessive trait. This means that, here are the options. Option A. Mothers carry the gene and pass it to their sons. Option B. Fathers carry the gene and pass it to their daughters. Option C. Both parents must have the disease for a child to have the disease. Option D. Both parents must be carriers for a child to have the disease. The correct answer is option D. Both parents must be carriers for a child to have the disease. A cystic fibrosis is not an X-linked or sex-linked disease. B. The only characteristic on the Y chromosome is the trait for hairy ears. C. Both parents do not need to have the disease but must be carriers. D. If a trait is recessive, 2 genes, 1 from each parent, are necessary to produce an affected child. Question 38. Diabetes mellitus is a disorder that affects 3.1 out of every 1,000 children younger than 20 years old. It is characterized by an absence of or marked decrease in circulating insulin. When teaching a newly diagnosed diabetes client, the nurse includes information on the functions of insulin. Here are the options. Option A. Transport of glucose into body cells and storage of glycogen in the liver. Option B. Glycogenolysis and facilitation of glucose use for energy. Option C. Glycogenolysis and catabolism. Option D. Catabolism and hyperglycemia. The correct answer is option A. Transport of glucose into body cells and storage of glycogen in the liver. A lack of insulin causes glycogenolysis, catabolism, and hyperglycemia. The insulin promotes the conversion of glucose to glycogen for storage and regulates the rate at which carbohydrates are used by cells for energy. C. Insulin is anabolic in nature. D. Glucose stimulates protein synthesis within the tissue and inhibits the breakdown of protein into amino acids. Question 39. A 14-year-old boy has had diabetes for 7 years. He takes 30 U of NPH insulin and 10 U of regular insulin every morning at 7 a.m. He eats breakfast at 7:30 a.m. and lunch at noon. What time should he expect the greatest risk for hypoglycemia? Here are the options. Option A. 9 a.m. Option B. 1 p.m. Option C. 11 a.m. Option D. 3 p.m. The correct answer is option C. 11 a.m. This time is incorrect because regular insulin would peak after the teenager has eaten breakfast. B. This time is incorrect because it is after lunch when the NPH peaks. C. Regular insulin peaks in 23 hours and has a duration of 46 hours. NPH insulin's onset is 46 hours and peaks in 816 hours. Blood sugar would peak after meals and be lowest before meals and during the night. D. This time is incorrect because it is before the NPH and after the regular insulin peak times. Question 40. A 16-year-old diabetic girl has been selected as a cheerleader at her school. She asks the nurse whether she should increase her insulin when she is planning to attend cheerleading practice sessions lasting from 8 to 11 a.m. The most appropriate answer would be, here are the options. Option A. You should ask your doctor about this. Option B. Yes, increase your insulin by 1 U for each hour of practice because exercise causes the body to need more insulin. Option C. No, do not increase your insulin. Exercise will not affect your insulin needs. Option D. No, do not increase your insulin, but eating a snack prior to practice exercise will make insulin more effective and move more glucose into the cells. The correct answer is option D. No, do not increase your insulin, but eating a snack prior to practice exercise will make insulin more effective and move more glucose into the cells. A nurse can give this information to a client. B. Exercise makes insulin more efficient in moving more glucose into the cells. No more insulin is needed. C. Exercise makes insulin more efficient unless the diabetes is poorly controlled. D. Exercise makes insulin more efficient in moving more glucose into the cells. Question 41. The physician decides to prescribe both a short-acting insulin and an intermediate-acting insulin for a newly diagnosed 8-year-old diabetic client. An example of a short-acting insulin is, here are the options. Option A, Novolin Regular. Option B, Humulin NPH. Option C, Lendbev. Option D, Protamine Zinc Insulin. The correct answer is option A, Novolin Regular. A Novolin is a short-acting insulin. B, C, NPH and Lent are intermediate-acting insulins. D, Protamine Zinc Insulin is a long-acting insulin preparation. Question 42. When preparing insulin for Roman 4 administration, the nurse identifies which kind of insulin to use. Here are the options. Option A, NPH. Option B, human or pork. Option C, regular. Option D, long-acting. The correct answer is option C, regular. A, B, D intermediate-acting and long-acting preparations contain materials that increase length of absorption time from the subcutaneous tissues but cause the preparation to be cloudy and unsuitable for Roman 4 use. Human insulin must be given as C. C only regular insulin can be given Roman 4. Question 43. A 33-year-old client is diagnosed with bipolar disorder, acute phase. This is her first psychiatric hospitalization, and she is being evaluated for treatment with lithium. Which of the following diagnostic tests are essential prior to the initiation of lithium therapy with this client? Here are the options. Option A, hematocrit, hemoglobin, and white blood cell WBC count. Option B, blood urea, nitrogen, electrolytes, and creatinine. Option C, glucose tolerance test, and random blood sugar. Option D, X-rays, electroencephalogram, and electrocardiogram ECG. The correct answer is option B, blood urea, nitrogen, electrolytes, and creatinine. These are general diagnostic blood studies usually done on admission, but they are not reliable indicators of lithium therapy clearance. These are the primary diagnostic tests to determine kidney functioning. Because lithium is excreted through the kidneys and because it can be very toxic, adequate renal function must be ascertained before therapy begins. These are diagnostic blood tests used to determine the presence of endocrine, not renal dysfunction. These are other types of diagnostic procedures used to determine musculoskeletal, neural, and cardiac rather than renal functioning. Question 44. A client has been taking lithium 300 mg per bid for the past 2 weeks. This morning her lithium level was 1 mg/L. The nurse should. Here are the options. Option A, notify the physician immediately. Option B, hold the morning lithium dose and continue to observe the client. Option C, administer the morning lithium dose as scheduled. Option D, obtain an order for benztropine cogentin. The correct answer is option C, administer the morning lithium dose as scheduled. There is no need to phone the physician because the lithium level is within therapeutic range and because there are no indications of toxicity present. B, there is no reason to withhold the lithium because the blood level is within therapeutic range. Also, it is necessary to give the medication as scheduled to maintain adequate blood levels. C, the lab results indicate that the client's lithium level is within therapeutic range 0.21.4 mg/L, so the medication should be given as ordered. D. Benztropine is an antiparkinsonism drug frequently given to counteract extrapyramidal symptoms associated with the administration of antipsychotic drugs, not lithium. Question 45. A 23-year-old male client is admitted to the chemical dependency unit with a medical diagnosis of alcoholism. He reports that the last time he drank was 3 days ago, and that now he is starting to feel kind of shaky. Based on the information given above, nursing care goals for this client will initially focus on. Here are the options. Option A. Self-concept problems. Option B. Interpersonal issues. Option C. Ineffective coping skills. Option D. Physiological stabilization. The correct answer is option D. Physiological stabilization. A self-concept and self-esteem problems may emerge during the client's treatment, but these are not immediate concerns. The interpersonal issues may become evident during the course of the client's treatment, but these are also not immediate areas of concern. C. Improving individual coping skills is generally a primary focus in the treatment and nursing care of persons with substance abuse problems. However, this is still not the immediate concern in this client's situation. D. Correction of fluid and electrolyte status and vitamin deficiencies, as well as prevention of delirium, is the immediate concern in the care of this client. Question 46. One afternoon, 3 weeks into his alcohol treatment program, a client says to the nurse, "It's really not all my fault that I have a drinking problem. Alcoholism runs in my family. Both my grandfather and father were heavy drinkers." The nurse's best response would be, "Here are the options. Option A. That might be a problem. Tell me more about them." Option B. Risk factors can often be controlled by self-responsibility. Option C. It sounds like you're intellectualizing your drinking problem. Option D. Your grandfather and father were both alcoholics. The correct answer is option B. Risk factors can often be controlled by self-responsibility. A focusing is an effective therapeutic strategy. This response, however, allows the client to defocus off the topic of learning how to accept responsibility for his behavior and future growth. B. The nurse can educate the client about both the genetic risk for the development of alcoholism and ways to make long-term healthy lifestyle changes. C. This response is inappropriately confrontational and condescending to the client. D. Reflection of content can be an effective verbal therapeutic technique. It is used inappropriately here. Question 47. A 14-year-old teenager is hospitalized for anorexia nervosa. She is admitted to the adolescent mental health unit and placed on a behavior modification program. Nursing interventions for the teenager will most likely include. Here are the options. Option A. Establishing routine tasks and activities around mealtimes. Option B. Administering medications such as lithium. Option C. Requiring the client to eat more during meals. Option D. Checking the client's room frequently. The correct answer is option A. Establishing routine tasks and activities around mealtimes. Providing a more structured, supportive environment addresses safety and comfort needs, thereby helping the anorexic client develop more internal control. B. Medications, commonly antidepressants, are frequently ordered for the anorexic client. However, lithium used primarily with bipolar disorder is not commonly used to treat the anorexic client. C. Requiring or demanding that the anorexic client eat more at mealtimes increases the client's feelings of powerlessness. D. Like the previous strategy, checking the client's room frequently contributes to the client's feelings of powerlessness. Question 48. A measurable outcome criterion in the nursing care of an adolescent with anorexia nervosa would be, here are the options. Option A, accepting her present body image. Option B, verbalizing realistic feelings about her body. Option C, having an improved perception of her body image. Option D, exhibiting increased self-esteem. The correct answer is option B, verbalizing realistic feelings about her body. A. This outcome criterion is inadequate because the term accepts is not directly measurable. B. This outcome criterion is directly measurable because specific goal-related verbalizations can be heard and verified by the nurse. C. Improved perception of body image is not directly measurable and is therefore open to many interpretations. D. Although long-term goals for the anorexic client should focus on increased self-esteem, this outcome criterion, as stated, does not include specific indicators or behaviors for which to observe. Question 49. A 23-year-old female client is brought to the emergency room by her roommate for repeatedly making superficial cuts on her wrists and experiencing wide mood swings. She is very angry and hostile. Her medical diagnosis is adjustment disorder versus borderline personality disorder. The client comments to the nurse, "Nobody in here seems to really care about the clients. I thought nurses cared about people." The client is exhibiting the ego defense mechanism. Here are the options. Option A, reaction formation. Option B, rationalization. Option C, splitting. Option D, sublimation. The correct answer is option C, splitting. A reaction formation is the development and demonstration of attitudes and/or behaviors opposite to what an individual actually feels. The client's comment does reveal her anger and hostility. B. Rationalization, another ego defense mechanism, is offering a socially acceptable or seemingly logical explanation to justify one's feelings, behaviors, or motives. The client's comment does not reflect rationalization. C. Splitting, the viewing of people or situations as either all good or all bad, is frequently used by persons experiencing a disruption in self-concept. This ego defense mechanism is reflective of the individual's inability to integrate the positive and negative aspects of self. D. Sublimation, the channeling of socially unacceptable impulses and behaviors into more acceptable patterns of behavior, is another ego defense mechanism. The client's comment reveals that she is not engaging in sublimation. Question 50. A client hospitalized with a medical diagnosis of adjustment disorder versus personality disorder states, "Nobody cares about the clients." The nurse's most effective response would be, here are the options. Option A, how can you say that I don't care? We just met. Option B, what makes you think the nurses don't care? Option C, you will feel differently about us in a few days. Option D, you seem angry. Tell me more about how you feel. The correct answer is option D, you seem angry. Tell me more about how you feel. A. This statement is a defensive response that places the nurse in a vulnerable countertransference position and at the same time fails to challenge the client's splitting behavior. B. This statement is a defensive response by the nurse. In addition, this type of non-therapeutic statement requests that the client explain the reasons for her behavior, a difficult task for an individual with limited insight. C. This statement is a non-therapeutic response that both ignores the intensity of the client's emotions and the dynamics underlying splitting behavior. D. By simultaneously acknowledging the client's emotional intensity and gently challenging her splitting behavior, the nurse addresses the client's current distortions and prepares for further interventions with angry or ambivalent feelings. Question 51. A 45-year-old client diagnosed with major depression is scheduled for electroconvulsive therapy (ECT) in the morning. Which of the following medications are routinely administered either before or during ECT? Here are the options. Option A. Thioridazine mellarol, lithium, and benztropine. Option B. Atropine, sodium brevitol, and succinylcholine chloride inctine. Option C. Sodium, potassium, and magnesium. Option D. Carbamazepine tegretol, haloperidol, and trihexyphenidyl artane. The correct answer is option B. Atropine, sodium brevitol, and succinylcholine chloride inctine. A thioridazine, an antipsychotic drug, lithium, an antimanic drug, and benztropine, an antiparkinsonism agent, are generally administered to treat schizophrenic and bipolar disorders. B. Atropine, a cholinergic blocker, sodium brevitol, a short-acting anesthetic, and succinylcholine, a neuromuscular blocker, are administered either before or during ECT to counteract bradycardia and to provide anesthesia and total muscle relaxation. C. These are electrolyte substances administered to correct fluid and electrolyte imbalances in the body. D. Carbamazepine, an anticonvulsant, haloperidol, an antipsychotic, and trihexyphenidyl, an antiparkinsonism agent, are usually administered in psychiatric settings to control problems associated with psychotic behavior. Question 52. A 35-year-old client is receiving psychopharmacological treatment of his major depression with tranylcypromine sulfate parnate, a monoamine oxidase MAO inhibitor. The nurse teaches the client that while he is taking this type of antidepressant, he needs to restrict his dietary intake of, here are the options. Option A. Potassium-rich foods. Option B. Tryptophan. Option C. Tyramine. Option D. Saturated fats. The correct answer is option C. Tyramine. The client may need to avoid some potassium-rich foods such as bananas, raisins, etc. However, this is not because of the potassium content of these foods. B-tryptophan is an essential amino acid that is present in high concentrations in animal and fish protein. C. The client will need to watch his dietary intake of tyramine. Tyramine is a byproduct of the conversion of tyrosine to epinephrine. Tyramine is found in a variety of foods and beverages, ranging from aged cheese to caffeine drinks. Ingestion of tyramine-rich foods while taking a MAO inhibitor may lead to an increase in blood pressure or a life-threatening hypertensive crisis. D. To maintain a healthy lifestyle, restriction of dietary saturated fats is advisable. Question 53. The nurse will be alert to the most potentially life-threatening side effect associated with the administration of monoamine oxidase MAO inhibitor. This is, here are the options. Option A. Oculogeric crisis. Option B. Hypertensive crisis. Option C. Orthostatic hypotension. Option D. Tardive dyskinesia. The correct answer is option B. Hypertensive crisis. A oculogeric crisis, involuntary upward deviation and fixation of the eyeballs, is usually associated with either post-encephalitic Parkinsonian or drug-induced extrapyramidal symptoms (EPS). The hypertensive crisis is a potentially life-threatening side effect. This may occur if the client ingests foods, beverages, or medications containing tyramine. C. Orthostatic hypotension. A drop in blood pressure resulting from a rapid change of body position can occur with the administration of antidepressants. D. Tardive dyskinesia, characterized by slow, rhythmical, automatic, or stereotyped muscular movements, usually is associated with the administration of certain antipsychotic medications. Question 54. A 38-year-old female client with a history of chronic schizophrenia, paranoid type, is currently an outpatient at the local mental health and mental retardation clinic. The client comes in once a week for medication evaluation and/or refills. She self-administers haloperidol 5 mg twice a day and benztropine 1 mg once a day. During her recent clinic visit, she says to the nurse, "I can't stay still at night. I toss and turn and can't fall asleep." The nurse suspects that she may be experiencing. Here are the options. Option A. Akathisia. Option B. Akinesia. Option C. Dystonia. Option D. Opisthotonos. The correct answer is option A. Akathisia. Akathisia, or motor restlessness, is a reversible APS frequently associated with the administration of antipsychotic drugs such as haloperidol. Akinesia, or muscular or motor retardation, is an example of reversible APS frequently associated with the administration of major tranquilizers such as haloperidol. C. Acute dystonic reactions, bizarre and severe muscle contractions usually of the tongue, face, neck, or extraocular muscles are examples of EPS. D. Opisthotonos, a severe type of whole-body dystonic reaction in which the head and heels are bent backward while the body is bowed forward, is an example of EPS. Question 55. On assessment, the nurse learns that a chronic paranoid schizophrenic has been taking the blue pill haloperidol in the morning and evening, and the white pill benztropine right before bedtime. The nurse might suggest to the client that she try. Here are the options. Option A. Doubling the daily dose of benztropine. Option B. Decreasing the haloperidol dosage for a few days. Option C. Taking the benztropine in the morning. Option D. Taking her medication with food or milk. The correct answer is option C. Taking the benztropine in the morning. A suggestion that a client increase a medication dosage is an inappropriate and illegal nursing action. This action requires a physician's order. B. To suggest that a client decrease a medication dosage is an inappropriate and illegal nursing action. This action requires a physician's order. C. This response is an appropriate independent nursing action. Because motor restlessness can also be a side effect of cogentin, the nurse may suggest that the client try taking the drug early in the day rather than at bedtime. D. Certain medications can cause gastric irritation and may be taken with food or milk to prevent this side effect. Question 56. A 27-year-old male client is admitted to the acute care mental health unit for observation. He has recently lost his job, and his wife told him yesterday that she wants a divorce. The client is placed on suicide precautions. In assessing suicide potential, the nurse should pay close attention to the clients. Here are the options. Option A. Level of insight. Option B. Thought processes. Option C. Mood and affect. Option D. Abstracting abilities. The correct answer is option C. Mood and affect. Assessing the client's level of insight is an important part of the mental status exam MSc, but it does not reflect suicide potential. B. Assessing the client's thought processes is an important part of the MSc, but it does not reflect suicide potential. C. Assessing the client's mood and affect is an important part of the MSc, and it can be a very valuable indicator of suicide potential. Frequently, a client who has decided to proceed with suicide plans will exhibit a suddenly improved mood and affect. Assessing a client's abstracting abilities is an important part of the MSE, but it does not reflect suicide potential. Question 57. The nurse knows that children are more susceptible to respiratory tract infections owing to physiological differences. These childhood differences, when compared to an adult, include. Here are the options. Option A. Fewer alveoli, slower respiratory rate. Option B. Diaphragmatic breathing, larger volume of air. Option C. Larger number of alveoli, diaphragmatic breathing. Option D. Rounded shape of chest, smaller volume of air. The correct answer is option D. Rounded shape of chest, smaller volume of air. Although a child has fewer alveoli than an adult, the child's respiratory rate is faster. Although a child may use diaphragmatic breathing, the adult exchanges a larger volume of air. The adult has a larger number of alveoli than a child. The child's chest is rounded whereas the adult chest is more of an oval shape, and the child does exchange a smaller volume of air than an adult. Question 58. A 2-year-old toddler is hospitalized with epiglottitis. In assessing the toddler, the nurse would expect to find. Here are the options. Option A. A productive cough. Option B. Expiratory stridor. Option C. Drooling. Option D. Crackles in the lower lobes. The correct answer is option C. Drooling. A productive cough is not associated with epiglottitis. Children with epiglottitis seldom have expiratory stridor. Inspiratory stridor is more common due to edema of the supraglottic tissues. Because of difficulty with swallowing, drooling often accompanies epiglottitis. Crackles are not heard in the lower lobes with epiglottitis because the infection is usually confined to the supraglottic structures. Question 59. Which of the following nursing care goals has the highest priority for a child with epiglottitis? Here are the options. Option A. Sleep or lie quietly 10 hours/day. Option B. Consume foods from all 4 food groups. Option C. Be febrile throughout her hospital stay. Option D. Participate in play activities 4 hours/day. The correct answer is option A. Sleep or lie quietly 10 hours/day. Of these 4 goals, maintenance of a calm, quiet atmosphere to reduce anxiety and to allow for rest is the most important. Although nutrition is important, the child needs fluids to maintain fluid and electrolyte balance more than solid foods. In addition, the child may not be able to swallow solid foods owing to epiglottic swelling. This goal is unrealistic because fever is a common symptom of the infection associated with epiglottitis. If overexerted, the child will need more O2 and energy than available, and these requirements may exacerbate the condition. Question 60. Which of the following nursing orders has the highest priority for a child with epiglottitis? Here are the options. Option A. Vital signs every shift. Option B. Tracheostomy set at bedside. Option C. Intake and output. Option D. Specific gravity every shift. The correct answer is option B. Tracheostomy set at bedside. Because of the possibility of fever or respiratory failure, vital signs should be done more often than every 8 hours. B. If the epiglottitis worsens, the edema and laryngospasm may close the airway and an emergency tracheostomy may be necessary. C. Although intake and output are a part of the nursing care of a child with epiglottitis, it is not as important as the safety measure of keeping the tracheostomy set at the bedside. D. Specific gravity will indicate hydration status, but it is not as important as keeping the tracheostomy set at the bedside. Question 61. Often children are monitored with pulse oximeter. The pulse oximeter measures the. Here are the options. Option A. O2 content of the blood. Option B. Oxygen saturation of arterial blood. Option C. O2. Option D. Affinity of hemoglobin for O2. The correct answer is option B. Oxygen saturation of arterial blood. The O2 content of whole blood is determined by the partial pressure of oxygen PO2 and the oxygen saturation. The pulse oximeter does not measure the PO2. B. The pulse oximeter is a non-invasive method of measuring the arterial oxygen saturation. C. The PO2 is the amount of O2 dissolved in plasma, which the pulse oximeter does not measure. D. The affinity of hemoglobin for O2 is the relationship between oxygen saturation and PO2 and is not measured by the pulse oximeter. Question 62. A 4-year-old boy is brought to the emergency room with bruises on his head, face, arms, and legs. His mother states that he fell down some steps. The nurse suspects that he may have been physically abused. In accordance with the law, the nurse must. Here are the options. Option A. Tell the physician her concerns. Option B. Report her suspicions to the authorities. Option C. Talk to the child's father. Option D. Confront the child's mother. The correct answer is option B. Report her suspicions to the authorities. Although the nurse probably would talk to the physician about these concerns, the nurse is not required by law to do so. B. All healthcare workers are required by the Federal Child Abuse Prevention and Treatment Act of 1974 to report suspected and actual cases of child abuse and or neglect. C. Talking to the child's father may or may not help the child, and the nurse is not required by law to do so. D. Confrontation may not be indicated. The nurse is not required by law to confront the child's mother with these suspicions. Question 63. The mother of a preschooler reports to the nurse that he frequently tells lies. The admission assessment of the child indicates possible child abuse. The nurse knows that his. Here are the options. Option A. Behavior is not normal, and a child psychiatrist should be consulted. Option B. Mother is lying to protect herself. Option C. Lying is normal behavior for a preschool child who is learning to separate fantasy from reality. Option D. Behavior indicates a developmental delay, because preschoolers should be able to tell right from wrong. The correct answer is option C. Lying is normal behavior for a preschool child who is learning to separate fantasy from reality. Because preschoolers often tell stories as they learn to differentiate fantasy from reality, the child's behavior is normal. B. The nurse has no reason to believe the child's mother is lying, because children of his age often tell lies. C. The child's lying is actually storytelling as he learns to separate fantasy from reality, a normal developmental task for his age group. D. The child's behavior is consistent with his age and does not indicate a developmental delay. Question 64. A family by court order undergoes treatment by a family therapist for child abuse. The nurse, who is the child's case manager, knows that treatment has been effective when. Here are the options. Option A. The child is removed from the home and placed in foster care. Option B. The child's parents identify the ways in which he is different from the rest of the family. Option C. The child's father is arrested for child abuse. Option D. The child's parents can identify appropriate behaviors for children in his age group. The correct answer is option D. The child's parents can identify appropriate behaviors for children in his age group. Removing an abused child from the home and placement in a foster home are not the desired outcome of treatment. The children who are perceived as different from the rest of the family are more likely to be abused. See, although legal action may be taken against abusive parents, it is not an indicator of an effective treatment program. De-identification of age-appropriate behaviors is essential to the role of parents, because misunderstanding children's normal developmental needs often contributes to abuse or neglect. Question 65. Nursing assessment of early evidence of septic shock in children at risk includes. Here are the options. Option A. Fever, tachycardia, and tachypnea. Option B. Respiratory distress, cold skin, and pale extremities. Option C. Elevated blood pressure, hyperventilation, and thready pulses. Option D. Normal pulses, hypotension, and oliguria. The correct answer is option A. Fever, tachycardia, and tachypnea. A fever, tachycardia, and tachypnea are the classic early signs of septic shock in children. The respiratory distress, cold skin, and pale extremities are later signs of septic shock. See, elevated blood pressure, hyperventilation, and thready pulses are later signs of septic shock. D. Normal pulses, hypotension, and oliguria are not early signs of septic shock. Question 66. A 3-year-old child is in the burn unit following a home accident. The first sign of sepsis in burned children is. Here are the options. Option A. Disorientation. Option B. Low-grade fever. Option C. Diarrhea. Option D. Hypertension. The correct answer is option A. Disorientation. A disorientation is the first sign of sepsis in burned children. The low-grade fever is not indicative of sepsis. C. Diarrhea is not indicative of sepsis. D. Hypertension is not indicative of sepsis. Question 67. One of the most reliable assessment tools for adequacy of fluid resuscitation in burned children is. Here are the options. Option A. Blood pressure. Option B. Level of consciousness. Option C. Skin turgor. Option D. Fluid intake. The correct answer is option B. Level of consciousness. A blood pressure can remain normotensive in a state of hypovolemia. B. Capillary refill, alterations in sensorium, and urine output are the most reliable indicators for assessing hydration. C. Skin turgor is not a reliable indicator for assessing hydration in a burn client. D. Fluid intake does not indicate adequacy of fluid resuscitation in a burn client. Question 68. A child with celiac disease is being discharged from the hospital. The mother demonstrates knowledge of nutritional needs of her child when she is able to state the foods which are included in A. Here are the options. Option A. Lactose-restricted diet. Option B. Gluten-restricted diet. Option C. Phenylalanine-restricted diet. Option D. Fat-restricted diet. The correct answer is option B. Gluten-restricted diet. A lactose-restricted diet is prescribed for children with lactose intolerance or diarrhea. B. A gluten-restricted diet is the diet for children with celiac disease. C. A phenylalanine-restricted diet is prescribed for children with phenylketonuria. D. A fat-restricted diet is prescribed for children with disorders of the liver, gallbladder, or pancreas. Question 69. An 80-year-old male client with a history of arteriosclerosis is experiencing severe pain in his left leg that started approximately 20 minutes ago. When performing the admission assessment, the nurse would expect to observe which of the following. Here are the options. Option A. Both lower extremities warm to touch with 2 pedal pulses. Option B. Both lower extremities cyanotic when placed in a dependent position. Option C. Decreased or absent pedal pulse in the left leg. Option D. The left leg warmer to touch than the right leg. The correct answer is option C. Decreased or absent pedal pulse in the left leg. This statement describes a normal assessment finding of the lower extremities. B. This assessment finding reflects problems caused by venous insufficiency. C. Decreased or absent pedal pulses reflect a problem caused by arterial insufficiency. D. The leg that is experiencing arterial insufficiency would be cooled to touch due to the decreased circulation. Question 70. A male client is scheduled to have angiography of his left leg. The nurse needs to include which of the following when preparing the client for this procedure. Here are the options. Option A. Validate that he is not allergic to iodine or shellfish. Option B. Instruct him to start active range of motion of his left leg immediately following the procedure. Option C. Inform him that he will not be able to eat or drink anything for 4 hours after the procedure. Option D. Inform him that vital signs will be taken every hour for 4 hours after the procedure. The correct answer is option A. Validate that he is not allergic to iodine or shellfish. Angiography, an invasive radiographic examination, involves the injection of a contrast solution iodine through a catheter that has been inserted into an artery. B. The client is kept on complete bed rest for 612 hours after the procedure. The extremity in which the catheter was inserted must be immobilized and kept straight during this time. C. The contrast dye, iodine, is nephrotoxic. The client must be instructed to drink a large quantity of fluids to assist the kidneys in excreting this contrast media. D. The major complication of this procedure is hemorrhage. Vital signs are assessed every 15 minutes initially for signs of bleeding. Question 71. A female client is started on warfarin Calmodin 5 mg per bed. To adequately evaluate the effectiveness of the warfarin therapy, the nurse must know that this medication. Here are the options. Option A. Dissolves any clots already formed in the arteries. Option B. Prevents the conversion of prothrombin to thrombin. Option C. Interferes with the synthesis of vitamin K-dependent clotting factors. Option D. Stimulates the manufacturing of platelets. The correct answer is option C. Interferes with the synthesis of vitamin K-dependent clotting factors. Thrombolytic agents, for example streptokinase, directly activate plasminogen, dissolving fibrin deposits, which in turn dissolves clots that have already formed. The heparin prevents the formation of clots by potentiating the effects of antithrombin Roman 3 and the conversion of prothrombin to thrombin. C. Warfarin prevents the formation of clots by interfering with the hepatic synthesis of the vitamin K-dependent clotting factors. D. Platelets initiate the coagulation of blood by adhering to each other and the site of injury to form platelet plugs. Question 72. A client is to be discharged from the hospital and is to continue taking warfarin 2.5 mg per bid. Which of the following should be included in her discharge teaching concerning the warfarin therapy? Here are the options. Option A. If you forget to take your morning dose, double the nighttime dose. Option B. You should take aspirin instead of acetaminophen Tylenol for headaches. Option C. Carry a medications alert card with you at all times. Option D. You should use a straight edge razor when shaving your arms and legs. The correct answer is option C. Carry a medications alert card with you at all times. A warfarin must always be taken exactly as directed. Clients should be instructed never to skip or double up on their dosage. The aspirin decreases platelet aggregation, which would potentiate the effects of the Coumadin. C. Healthcare providers need to be aware of persons on warfarin therapy prior to the initiation of any diagnostic tests and/or surgery to help prevent bleeding complications. D. An electric razor should be used to prevent accidental cutting, which can lead to bleeding. Question 73. A 40-year-old client has been admitted to the hospital with severe substernal chest pain radiating down his left arm. The nurse caring for the client establishes the following priority nursing diagnosis alteration in comfort pain related to. Here are the options. Option A. Increased excretion of lactic acid due to myocardial hypoxia. Option B. Increased blood flow through the coronary arteries. Option C. Decreased stimulation of the sympathetic nervous system. Option D. Decreased secretion of catecholamines secondary to anxiety. The correct answer is option A. Increased excretion of lactic acid due to myocardial hypoxia. A anaerobic metabolism results because the decreased blood supply to the myocardium causes a release of lactic acid. Lactic acid is an irritant to the myocardial neural receptors, producing chest pain. The chest pain is caused by a decrease in the O2 supply to the myocardial cells. Treatment modalities for chest pain are aimed toward increasing the blood flow through coronary arteries. C. Chest pain causes an increase in the stimulation of the sympathetic nervous system. This stimulation increases the heart rate and blood pressure, causing an increase in myocardial workload aggravating the chest pain. D. Chest pain and anxiety cause increased secretion of catecholamines by stimulating the sympathetic nervous system. This stimulation increases chest pain by increasing the workload of the heart. Question 74. Morphine sulfate 4 mg Roman 4 push Q2 HPRN for chest pain was ordered for a client in the emergency room with severe chest pain. The nurse administering the morphine sulfate knows which of the following therapeutic actions is related to the morphine sulfate. Here are the options. Option A. Increased level of consciousness. Option B. Increased rate and depth of respirations. Option C. Increased peripheral vasodilation. Option D. Increased perception of pain. The correct answer is option C. Increased peripheral vasodilation. A morphine sulfate, a narcotic analgesic, causes sedation and a decrease in level of consciousness. B. The side effects of morphine sulfate include respiratory depression. C. Morphine sulfate causes peripheral vasodilation, which decreases afterload, producing a decrease in the myocardial workload. D. Morphine sulfate alters the perception of pain through an unclear mechanism. This alteration promotes pain relief. Question 75. A client had a cardiac catheterization with angiography and thrombolytic therapy with streptokinase. The nurse should initiate which of the following interventions immediately after he returns to his room? Here are the options. Option A. Place him on NPO restriction for 4 hours. Option B. Monitor the catheterization site every 15 minutes. Option C. Place him in a high Fowler position. Option D. Ambulate him to the bathroom to void. The correct answer is option B. Monitor the catheterization site every 15 minutes. A contrast dye, iodine, is used in this procedure. This dye is nephrotoxic. The client must be encouraged to drink plenty of liquids to assist the kidneys in eliminating the dye. B. Streptokinase activates plasminogen, dissolving fibrin deposits. To prevent bleeding, pressure is applied at the insertion site. The client is assessed for both internal and external bleeding. C. The extremity used for the insertion site must be kept straight and be immobilized because of the potential for bleeding. D. The client is kept on bed rest for 812 hours following the procedure because of the potential for bleeding. Question 76. The nurse notes scattered crackles in both lungs and 1+ pitting edema when assessing a cardiac client. The physician is notified and orders furosemide Lasix 80 mg Roman 4 push stat. Which of the following diagnostic studies is monitored to assess for a major complication of this therapy? Here are the options. Option A. Serum electrolytes. Option B. Arterial blood gases. Option C. Complete blood count. Option D. 12-lead EC. The correct answer is option A. Serum electrolytes. A furosemide, a potassium-depleting diuretic, inhibits the reabsorption of sodium and chloride from the loop of Henle and the distal renal tubules. Serum electrolytes are monitored for hypokalemia. B. Severe acid-base imbalances influence the movement of potassium into and out of the cells, but arterial blood gases do not measure the serum potassium level. C. Furosemide is a potassium-depleting diuretic. A complete blood count does not reflect potassium levels. D. Abnormalities in potassium. Both hyperkalemia and hypokalemia are reflected in ECG changes, but these changes do not occur until the abnormality is severe. Question 77. Prior to his discharge from the hospital, a cardiac client is started on digoxin lanixin 25 mg POQD. The nurse initiates discharge teaching. Which of the following statements by the client would validate an understanding of his medication? Here are the options. Option A. I would notify my physician immediately if I experience nausea, vomiting, and double vision. Option B. I could stop taking this medication when I begin to feel better. Option C. I should only take the medication if my heart rate is greater than 100 bpm. Option D. I should always take this medication with an antacid. The correct answer is option A. I would notify my physician immediately if I experience nausea, vomiting, and double vision. The first signs of digoxin toxicity include abdominal pain, anorexia, nausea, vomiting, and visual disturbances. The physician should be notified if any of these symptoms are experienced. B. The positive inotropic effects of digoxin increase cardiac output and result in an enhanced activity tolerance. Feeling better indicates the drug is working and medication therapy must be continued. C. Clients should be taught to take their pulse prior to taking the digoxin. If their pulse rate becomes irregular, slows significantly, or is 100 bpm, the physician should be notified. D. Antacids decrease the effectiveness of digoxin. Question 78. When assessing a client, the nurse notes the typical skin rash seen with systemic lupus erythematosus. Which of the following descriptions correctly describes this rash? Here are the options. Option A. Small round or oval reddish-brown macules scattered over the entire body. Option B. Scattered clusters of macules, papules, and vesicles over the body. Option C. Bright red appearance of the palmar surface of the hands. Option D. Red and butterfly-shaped rash over the cheeks and nose. The correct answer is option D. Red and butterfly-shaped rash over the cheeks and nose. The appearance of small, round, or oval reddish-brown macules scattered over the entire body is characteristic of rubeola. B. The appearance of scattered clusters of macules, papules, and vesicles throughout the body is characteristic of chickenpox. C. Palmar redness is seen in clients with cirrhosis of the liver. D. The characteristic butterfly rash over the cheek and nose and into the scalp is seen with systemic lupus erythematosus. Question 79. The nurse notes multiple bruises on the arms and legs of a newly admitted client with lupus. The client states, "I get them whenever I bump into anything." The nurse would expect to note a decrease in which of the following laboratory tests? Here are the options. Option A. Number of platelets. Option B. WBC count. Option C. Hemoglobin level. Option D. Number of lymphocytes. The correct answer is option A. Number of platelets. A thrombocytopenia, a decrease in platelets, occurs in lupus and causes a decrease in blood coagulation and thrombus formation. B. Clients with lupus will have a decrease in the WBC count, decreasing their resistance to infection. C. Clients with lupus may have a decrease in the hemoglobin level, causing anemia. D. Leukopenia, a decrease in white blood cells, is seen in lupus and decreases resistance to infection. Question 80. A client is started on prednisone 2.5 mg per bid. Which of the following instructions should be included in her discharge teaching specific to this medication? Here are the options. Option A. Increase your oral intake of fluids to at least 4,000 ml every day. Option B. Avoid contact with people who have contagious illnesses. Option C. Brush your teeth at least 4 times a day with a firm toothbrush. Option D. Immediately stop taking the prednisone if you feel depressed. The correct answer is option B. Avoid contact with people who have contagious illnesses. A fluid retention is a side effect of prednisone. The nurse should teach clients to weigh themselves daily and to observe for signs of edema. If these signs of fluid retention occur, they should notify the physician. B. Prednisone, a glucocorticoid, suppresses the normal immune response, making the client more susceptible to infections. C. An increase in bleeding tendencies is a side effect of prednisone therapy. The nurse should teach clients to use preventive measures, i.e. electric razors and soft toothbrushes. D. Depression and personality changes are side effects of prednisone therapy. Prednisone should never be discontinued abruptly. Question 81. During the assessment, the nurse observes a client scratching his skin. He has been admitted to rule out Lennox cirrhosis of the liver. The nurse knows the pruritus is directly related to. Here are the options. Option A. A loss of phagocytic activity. Option B. Faulty processing of bilirubin. Option C. Enhanced detoxification of drugs. Option D. The formation of collateral circulation. The correct answer is option B. Faulty processing of bilirubin. A loss in the phagocytic activity of the Kupffer cells occurs with cirrhosis of the liver, which increases the susceptibility to infections. B. The faulty processing of bilirubin produces bile salts, which are irritating to the skin. C. The detoxification of drugs is impaired with cirrhosis of the liver. D. Collateral circulation develops due to portal hypertension. This is manifest through the development of esophageal varices, hemorrhoids, and capmedusae. Question 82. 4 days after admission for cirrhosis of the liver, the nurse observes the following when assessing a male client: increased irritability, asterixis, and changes in his speech pattern. Which of the following foods would be appropriate for his bedtime snack? Here are the options. Option A, fresh fruit. Option B, a milkshake. Option C, saltine crackers and peanut butter. Option D, a ham and cheese sandwich. The correct answer is option A, fresh fruit. High levels of ammonia, a byproduct of protein metabolism, can precipitate metabolic encephalopathy. These clients need a diet high in carbohydrates and bulk. B. Metabolic encephalopathy of the brain associated with liver failure is precipitated by elevated ammonia levels. Ammonia is a byproduct of protein metabolism. C. D. Metabolic encephalopathy in liver failure is precipitated by elevated ammonia levels. Ammonia is a byproduct of protein metabolism. Question 83. 4 days after admission for cirrhosis of the liver, the nurse observes the following when assessing a male client: increased irritability, asterixis, and changes in his speech pattern. Which of the following foods would be appropriate for his bedtime snack? Here are the options. Option A, fresh fruit. Option B, a milkshake. Option C, saltine crackers and peanut butter. Option D, a ham and cheese sandwich. The correct answer is option B, a milkshake. Albumin, a blood volume expander, increases the circulating blood volume by exerting an osmotic pull on tissue fluids, pulling them into the vascular system. This fluid shift causes an increase in the heart rate and blood pressure. B. Albumin, a blood volume expander, exerts an osmotic pull on fluids in the interstitial spaces, pulling the fluid back into the circulatory system. This fluid shift causes an increase in the urinary output. C. Adventitious breath sounds and dyspnea can occur due to circulatory overload if the albumin is infused too rapidly. D. Chills, fever, itching, and rashes are signs of a hypersensitivity reaction to albumin. Question 84. A client with cirrhosis of the liver becomes comatose and is started on neomycin 300 mg Q6H via an epigastric tube. The rationale for this therapy is to. Here are the options. Option A, prevent systemic infection. Option B, promote diuresis. Option C, decrease ammonia formation. Option D, acidify the small bowel. The correct answer is option C, decrease ammonia formation. A neomycin is an antibiotic, but this is not the rationale for administering it to a client in hepatic coma. Diuretics and salt-free albumin are used to promote diuresis in clients with cirrhosis of the liver. C. Neomycin destroys the bacteria in the intestines. It is the bacteria in the bowel that break down protein into ammonia. D-lactulose is administered to create an acid environment in the bowel. Ammonia leaves the blood and migrates to this acidic environment where it is trapped and excreted. Question 85. The following nursing diagnosis is written for a comatose client with cirrhosis of the liver and secondary splenomegaly, high risk for injury, increased susceptibility to bleeding related to. Here are the options. Option A, increased absorption of vitamin K. Option B, thrombocytopenia due to hypersplenism. Option C, diminished function of the Kupffer cells. Option D, increased synthesis of the clotting factors. The correct answer is option B, thrombocytopenia due to hypersplenism. There is a decreased absorption of vitamin K with cirrhosis of the liver. This decrease impairs blood coagulation and the formation of prothrombin. B. Thrombocytopenia, an increased destruction of platelets, occurs secondary to hypersplenism. C. A diminished function of the Kupffer cells occurs with cirrhosis of the liver, causing the client to become more susceptible to infections. D. A decrease in the synthesis of fibrinogen and clotting factors. Roman 7, Roman 9, and X occurs with cirrhosis of the liver and increases the susceptibility to bleeding. Question 86. A 52-year-old female client is admitted to the hospital in acute renal failure. She has been on hemodialysis for the past 2 years. Stat arterial blood gases are drawn on the client yielding the following results: pH 7.30, PCO2 51 mmHg, HCO3 18 mXL, PaO2 84 mmHg. The nurse would interpret these results as, here are the options. Option A, compensated metabolic alkalosis. Option B, respiratory acidosis. Option C, partially compensated metabolic alkalosis. Option D, combined respiratory and metabolic acidosis. The correct answer is option D, combined respiratory and metabolic acidosis. A compensated metabolic alkalosis would be reflected by the following: pH within normal limit 7.35 7.45, PCO2 45 mmHg, HCO3 26 mXL. B. Respiratory acidosis would be reflected by the following: pH 7.35, PCO2 45 mmHg, HCO3 within normal limits 2226 mx/L. C. Partially compensated metabolic alkalosis would be reflected by the following: pH 7.45, PCO2 45 mmHg, HCO3 26 mxL. D. Combined respiratory and metabolic acidosis would be reflected by the following: pH 7.35, PCO2 45 mmHg, HCO3 22 mxL. Question 87. Stats serum electrolytes ordered for a client in acute renal failure revealed a serum potassium level of 6.4. The physician is immediately notified and orders 50 ml of dextrose and 10 U of regular insulin. Roman 4 push. The nurse administering these drugs knows the rationale for this therapy is to. Here are the options. Option A, remove the potassium from the body by renin exchange. Option B, protect the myocardium from the effects of hypokalemia. Option C, promote rapid protein catabolism. Option D, drive potassium from the serum back into the cells. The correct answer is option D, drive potassium from the serum back into the cells. A sodium polystyrene sulfonate cake-salate, a cation exchange resin, exchanges sodium ions for potassium ions in the large intestine, reducing the serum potassium. The calcium is administered to protect the myocardium from the adverse effects of hyperkalemia. Serum levels reflect hyperkalemia. C. Rapid catabolism releases potassium from the body tissue into the bloodstream. Infection and hyperthermia increase the process of catabolism. D. The administration of dextrose and regular insulin Roman 4 forces potassium back into the cells, decreasing the potassium in the serum. Question 88. The nurse writes the following nursing diagnosis for a client in acute renal failure impaired gas exchange related to. Here are the options. Option A. Decreased red blood cell production. Option B. Increased levels of vitamin D. Option C. Increased red blood cell production. Option D. Decreased production of renin. The correct answer is option A. Decreased red blood cell production. A red blood cell production is impaired in renal failure owing to impaired erythropoietin production. This causes a decrease in the delivery of oxygen to the tissue and impairs gas exchange. B. The conversion of vitamin D to its physiologically active form is impaired in renal failure. C. In renal failure, a decrease in red blood cell production occurs owing to an impaired production of erythropoietin, leading to impaired gas exchange at the cellular level. D. The decreased production of renin in renal failure causes an increased production of aldosterone, causing sodium and water retention. Question 89. A 6-year-old child returned to the surgical floor 20 hours ago after an appendectomy for a gangrenous appendix. His mother tells the nurse that he is becoming more restless and is anxious. Assessment findings indicate that the child has atelectasias. Appropriate nursing actions would include, here are the options. Option A. Allowing the child to remain in the position of comfort, preferably semi or high Fowler position. Option B. Administering analgesics as ordered. Option C. Having the child turn, cough, and deep breathe every 12 hours. Option D. Remaining with the child and keeping as calm and quiet as possible. The correct answer is option C. Having the child turn, cough, and deep breathe every 12 hours. Allowing the client to remain in the position of comfort will not resolve the atelectasias. This position, if left unchanged over time, may actually increase the atelectasias. B. Analgesics will not resolve the atelectasias and may contribute to it if proper nursing actions are not taken to help resolve the atelectasias. C. Having the client turn, cough, and deep breathe every 12 hours will aid in resolving the atelectasias. Surgery clients are at risk for postoperative respiratory complications because pulmonary function is reduced as a result of anesthesia and surgery. D. Remaining with the client and keeping him calm and quiet will not affect the client's anxiety, restlessness, or help to resolve the atelectasias. The cause atelectasias needs to be treated, not the symptoms anxiety and restlessness. Question 90. A client develops an intestinal obstruction postoperatively. A nasogastric tube is attached to low, intermittent suction with orders to irrigate NG tube with sterile saline Q1H and PRN. The rationale for using sterile saline as opposed to using sterile water to irrigate PNG tube is, here are the options. Option A. Water will deplete electrolytes resulting in metabolic acidosis. Option B. Saline will reduce the risk of severe, colicky abdominal pain during NG irrigation. Option C. Water is not isotonic and will increase restlessness and insomnia in the immediate postoperative period. Option D. Saline will increase peristalsis in the bowel. The correct answer is option A. Water will deplete electrolytes resulting in metabolic acidosis. A water is a hypotonic solution and will deplete electrolytes and cause metabolic acidosis when used for nasogastric irrigation. B. Irrigating with saline does not cause abdominal discomfort. Severe, colicky abdominal pain is a symptom of intestinal obstruction. C. Irrigating with water will not cause restlessness or insomnia in the postoperative client. Restlessness and insomnia can be emotional complications of surgery. D. A nasogastric tube placed in the stomach is used to decompress the bowel. Irrigating with saline ensures a patent, well-functioning tube. Irrigating with saline will not increase peristalsis. Question 91. A 35-year-old client has returned to her room following surgery on her right femur. She has N-Roman 4 of D5 and 1/2 normal saline infusing at 125 ml/HR and is receiving morphine sulfate 1015 mg IMQ4 HPRN for pain. She last voided 51-2 hours ago when she was given her preoperative medication. In monitoring and promoting return of urinary function after surgery, the nurse would. Here are the options. Option A. Provide food and fluids at the client's request. Option B. Maintain Roman 4, increasing the rate hourly until the client voids. Option C. Report to the surgeon if the client is unable to void within 8 hours of surgery. Option D. Hold morphine sulfate injections for pain until the client voids, explaining to her that morphine sulfate can cause urinary retention. The correct answer is option C. Report to the surgeon if the client is unable to void within 8 hours of surgery. A provision of food and fluid promotes bowel elimination. Nutritional needs postoperatively are determined by the physician, not the client. B. Increasing Roman 4 fluids postoperatively will not cause a client to void. Any change in rate of administration of Roman 4 fluids should be determined by the physician. C. The postoperative client with normal kidney function who cannot void 8 hours after surgery is retaining urine. The client may need catheterization or medication. The physician must provide orders for both as necessary. D. Although morphine sulfate can cause urinary retention, withholding pain medication will not ensure that the client will void. The client with uncontrolled pain will probably not be able to void. Question 92. A 47-year-old male client is admitted for colon surgery. Intravenous antibiotics are begun 2 hours prior to surgery. He has no known infection. The rationale for giving antibiotics prior to surgery is to. Here are the options. Option A. Provide cathartic action within the colon. Option B. Reduce the risk of wound infection from anaerobic bacteria. Option C. Relieve the client's concern regarding possible infection. Option D. Reduce the risk of intraoperative fever. The correct answer is option B. Reduce the risk of wound infection from anaerobic bacteria. A cathartic drugs promote evacuation of intestinal contents. B. The client undergoing intestinal surgery is at increased risk for infection from large numbers of anaerobic bacteria that inhabit the intestines. Administering antibiotics prophylactically can reduce the client's risk for infection. C. Antibiotics are indicated in the treatment of infections and have no effect on emotions. D. Antipyretics are useful in the treatment of elevated temperatures. Antibiotics would have an effect on infection, which causes temperature elevation, but would not directly affect such an elevation. Question 93. A 19-month-old child is admitted to the hospital for surgical repair of patent ductus arteriosus. The child is being given digoxin. Prior to administering the medication, the nurse should. Here are the options. Option A. Not give the digoxin if the pulse is 60. Option B. Not give the digoxin if the pulse is 100. Option C. Take the apical pulse for a full minute. Option D. Monitor for visual disturbances, a side effect of digoxin. The correct answer is option C. Take the apical pulse for a full minute. A digoxin should not be given to adults with an apical pulse 60 bpm. V-digoxin should be given to children with an apical pulse 100 bpm. With a pulse 100 bpm, the medication should be withheld and the physician notified. See prior to digoxin administration in both children and adults. An apical pulse should be taken for 1 full minute. Aside from the rate per minute, the nurse should note any sudden increase or decrease in heart rate, irregular rhythm, or regularization of a chronic irregular heart rhythm. The early indications of digoxin toxicity, such as visual disturbances, occur rarely as initial signs in children. Question 94. The family member of a child scheduled for heart surgery states, "I just don't understand this open heart or closed heart business. I'm so confused. Can you help me understand it?" The nurse explains that patent ductus arteriosus repair is. Here are the options. Option A. Open heart surgery. The child will be placed on a heart-lung machine while the surgery is being performed. Option B. Closed heart surgery. It does not require that the child be placed on the heart-lung machine while the surgery is being performed. Option C. A pediatric version of the coronary artery bypass graft surgery performed on adults. It is an open heart surgery. Option D. A pediatric version of percutaneous transluminal coronary angioplasty performed on adults. It is a closed heart surgery. The correct answer is option B, closed heart surgery. It does not require that the child be placed on the heart-lung machine while the surgery is being performed. A patent ductus arteriosus repair is a closed heart procedure. The client is not placed on a heart-lung machine. The patent ductus arteriosus is a ductus arteriosus that does not close shortly after birth but remains patent. Repair is a closed heart procedure involving ligation of the patent ductus arteriosus. C. Coronary artery bypass graft surgery is an open heart surgical procedure in which blocked coronary arteries are bypassed using vessel grafts. D. Percutaneous transluminal coronary angioplasty is a closed heart procedure that improves coronary blood flow by increasing the lumen size of narrowed vessels. Question 95. A child is to receive atropine 0.15 mg 1-400 g as part of his preoperative medication. A vial containing atropine 0.4 mg 1-150 g/ml is on hand. How much atropine should be given? Here are the options. Option A, 0.06 ml. Option B, 0.38 ml. Option C, 2.7 ml. Option D, information given insufficient to determine the amount of atropine to be administered. The correct answer is option B, 0.38 ml. A. C. Information was incorrectly placed in the formula, resulting in an incorrect answer. B. The answer is correct. 0.4 mg equals 1 ml: 0.15 mg 5 equals ml 0.4 x equals 0.15 x equals 0.15/0.4 x equals 0.375 or 0.38 mld. Sufficient information is provided to determine the amount of atropine to administer. The amount of atropine available and the amount of atropine ordered is required to determine the amount of atropine to be given. Question 96. Following a gastric resection, a 70-year-old client is admitted to the post-anesthesia care unit. He was extubated prior to leaving the suite. On arrival at the post-anesthesia care unit, the nurse should. Here are the options. Option A. Check airway, feeling for amount of air exchange noting rate, depth, and quality of respirations. Option B. Obtain pulse and blood pressure readings noting rate and quality of pulse. Option C. Reassure the client that his surgery is over and that he is in the recovery room. Option D. Review physician's orders administering medications as ordered. The correct answer is option A. Check airway, feeling for amount of air exchange noting rate, depth, and quality of respirations. Adequate air exchange and tissue oxygenation depend on competent respiratory function. Checking the airway is the nurse's priority action. B. Obtaining the vital signs is an important action, but it is secondary to airway management. C. Reorienting a client to time, place, and person after surgery is important, but it is secondary to airway and vital signs. D. Airway management takes precedence over physician's orders unless they specifically relate to airway management. Question 97. A 25-year-old client is admitted for a tonsillectomy. She tells the nurse that she has had episodes of muscle cramps, weakness, and unexplained temperature elevation. Many years ago, her father died shortly after surgery after developing a high fever. She further tells the nurse that her surgeon is having her take dantrolene sodium dantrium prophylactically prior to her tonsillectomy. Dantrolene sodium is ordered preoperatively to reduce the risk or prevent. Here are the options. Option A. Infection postoperatively. Option B. Malignant hyperthermia. Option C. Neuroleptic malignant syndrome. Option D. Fever postoperatively. The correct answer is option B. Malignant hyperthermia. A. D-dantrolene sodium is a peripheral skeletal muscle relaxant and would have no effect on a postoperative infection. B. Dantrolene sodium is indicated prophylactically for clients with malignant hyperthermia or with a family history of the disorder. The mortality rate for malignant hyperthermia is high. C. Neuroleptic malignant syndrome is an exercise-induced muscle pain and spasm and is unrelated to malignant hyperthermia. Question 98. A 44-year-old client had an emergency cholecystectomy 3 days ago for a ruptured gallbladder. She complains of severe abdominal pain. Assessment reveals abdominal rigidity and distension, increased temperature, and tachycardia. Diagnostic testing reveals an elevated WBC count. The nurse suspects that the client has developed. Here are the options. Option A. Gastritis. Option B. Evisceration. Option C. Peritonitis. Option D. Pulmonary embolism. The correct answer is option C. Peritonitis. A assessment findings for gastritis would reveal anorexia, nausea and vomiting, epigastric fullness and tenderness and discomfort. B. Evisceration is the extrusion of abdominal viscera as a result of trauma or sutures failing in a surgical incision. C. Peritonitis, inflammation of the peritoneum, can occur when an abdominal organ, such as the gallbladder, perforates and leaks blood and fluid into the abdominal cavity. This causes infection and irritation. D. Assessment findings of pulmonary embolism would reveal severe substernal chest pain, tachycardia, tachypnea, shortness of breath, anxiety or panic, and wheezing and coughing, often accompanied by blood-tinged sputum. Question 99. A 35-year-old client is admitted to the hospital for elective tubal ligation. While the nurse is doing preoperative teaching, the client says, "The anesthesiologist said she was going to give me balanced anesthesia." What exactly is that? The best explanation for the nurse to give the client would be that balanced anesthesia. Here are the options. Option A is a type of regional anesthesia. Option B uses equal amounts of inhalation agents and liquid agents. Option C does not suppress the central nervous system. Option D is a combination of several anesthetic agents or drugs producing a smooth induction and minimal complications. The correct answer is option D, is a combination of several anesthetic agents or drugs producing a smooth induction and minimal complications. A regional anesthesia does not produce loss of consciousness and is indicated for excision of moles, cysts, and endoscopic surgeries. Varying amounts of anesthetic agents are used when employing balanced anesthesia. Amounts depend on age, weight, condition of the client, and surgical procedure. C. General anesthesia is a drug-induced depression of the central nervous system that produces loss of consciousness and decreased muscle activity. D. Balanced anesthesia is a combination of a number of anesthetic agents that produce a smooth induction, appropriate depth of anesthesia, and appropriate muscle relaxation with minimal complications. Question 100. A 29-year-old client is admitted for a hysterectomy. She has repeatedly told the nurses that she is worried about having this surgery, has not slept well lately, and is afraid that her husband will not find her desirable after the surgery. Shortly into the preoperative teaching, she complains of a tightness in her chest, a feeling of suffocation, lightheadedness, and tingling in her hands. Her respirations are rapid and deep. Assessment reveals that the client is. Here are the options. Option A, having a heart attack. Option B, wanting attention from the nurses. Option C, suffering from complete upper airway obstruction. Option D, hyperventilating. The correct answer is option D, hyperventilating. A classic symptoms of a heart attack include heaviness or squeezing pain in the chest, pain spreading to the jaw, neck, and arm. Nausea and vomiting, sweating, and shortness of breath may be present. The client does not exhibit these symptoms. B. Clients suffering from anxiety or fear prior to surgical procedures may develop hyperventilation. This client is not seeking attention. C. Symptoms of complete airway obstruction include not being able to speak and no airflow between the nose and mouth. Breath sounds are absent. D. Tightness in the chest, a feeling of suffocation, lightheadedness, tingling in the hands, and rapid, deep respirations are signs and symptoms of hyperventilation. This is almost always a manifestation of anxiety. Question 101. A client develops complications following a hysterectomy. Blood cultures reveal Pseudomonas aeruginosa. The nurse expects that the physician would order an appropriate antibiotic to treat P. aeruginosa, such as, here are the options. Option A, cefoperazone cefabid. Option B, clindamycin cliocin. Option C, dicloxacillin dicyl. Option D, erythromycin erythrocin. The correct answer is option A, cefoperazone cefabid. A cefoperazone is indicated in the treatment of infection with Pseudomonas aeruginosa. V. Clindamycin is not indicated in the treatment of infection with P. aeruginosa. C. Dicloxacillin is not indicated in the treatment of infection with P. aeruginosa. D. Erythromycin is not indicated in the treatment of infection with P. aeruginosa. Question 102. A couple is experiencing difficulties conceiving a baby. The nurse explains basal body temperature (BBT) by instructing the female client to take her temperature. Here are the options. Option A. Orally in the morning and at bedtime. Option B. Only one time during the day as long as it is always at the same time of day. Option C. Rectally at bedtime. Option D. As soon as she awakens, prior to any activity. The correct answer is option D. As soon as she awakens, prior to any activity. A monitoring temperature twice a day predicts the biphasic pattern of ovulation. The prediction of ovulation relies on consistency in taking temperature. C. Nightly rectal temperatures are more accurate in predicting ovulation. D. Activity changes the accuracy of basal body temperature and ability to detect the luteinizing hormone surge. Question 103. A client is having episodes of hyperventilation related to her surgery that is scheduled tomorrow. Appropriate nursing actions to help control hyperventilating include, here are the options. Option A. Administering diazepam Valium 1015 mg po Q4H and Q1HPRN for hyperventilating episode. Option B. Keeping the temperature in the client's room at a high level to reduce respiratory stimulation. Option C. Having the client hold her breath or breathe into a paper bag when hyperventilation episodes occur. Option D. Using distraction to help control the client's hyperventilation episodes. The correct answer is option C. Having the client hold her breath or breathe into a paper bag when hyperventilation episodes occur. An adult's diazepam dosage for treatment of anxiety is 210 mg po 24 times daily. The order as written would place a client at risk for overdose. B. A high room temperature could increase hyperventilating episodes by stimulating the respiratory system. C. Breath holding and breathing into a paper bag may be useful in controlling hyperventilation. Both measures increase CO2 retention. D. Distraction will not prevent or control hyperventilation caused by anxiety or fear. Question 104. A client delivered a stillborn male at term. An appropriate action of the nurse would be to. Here are the options. Option A. State, "You have an angel in heaven." Option B. Discourage the parents from seeing the baby. Option C. Provide an opportunity for the parents to see and hold the baby for an undetermined amount of time. Option D. Reassure the parents that they can have other children. The correct answer is option C. Provide an opportunity for the parents to see and hold the baby for an undetermined amount of time. This is not a supportive statement. There are also no data to indicate the family's religious beliefs. B. Seeing their baby assists the parents in the grieving process. This gives them the opportunity to say goodbye. C. Parents need time to get to know their baby. D. This is not a comforting statement when a baby has died. There are also no guarantees that the couple will be able to have another child. Question 105. A pregnant client is having a non-stress test NST. It is noted that the fetal heartbeat rises 20 BPM, lasting 20 seconds, every time the fetus moves. The nurse explains that. Here are the options. Option A. The test is inconclusive and should be repeated. Option B. Further testing is needed. Option C. The test is normal and the fetus is reacting appropriately. Option D. The fetus is distressed. The correct answer is option C. The test is normal and the fetus is reacting appropriately. A. The test results were normal, so there would be no need to repeat to determine results. B. There are no data to indicate further tests are needed, because the result of the NSD was normal. C, an NSD is reported as reactive if there are 2 to 3 increases in the fetal heart rate of 15 bpm, lasting at least 15 seconds during a 15-minute period. D, the NSD results were normal, so there was no fetal distress. Question 106. Which stage of labor lasts from delivery of the baby to delivery of the placenta? Here are the options. Option A. Second. Option B. Third. Option C. Fourth. Option D. Fifth. The correct answer is option B. Third. This stage is from complete dilatation of the cervix to delivery of the fetus. B, this is the correct stage for the definition. C, the stage lasts for about 2 hours after the delivery of the placenta. D, there is no fifth stage of labor. Question 107. On the third postpartum day, the nurse would expect the lochia to be. Here are the options. Option A. Rubra. Option B. Dorotha. Option C. Alva. Option D. That. The correct answer is option A. Rubra. This discharge occurs from delivery through the third day. There is dark red blood, placental debris, and clots. This discharge occurs from days 410. The lochia is brownish, serous, and thin. C, this discharge occurs from day 10 through the 6th week. The lochia is yellowish-white. D, this is not a classification of lochia, but relates to the amount of discharge.